Alright, so in this video, I'm going to show you my suture material, and then I've got my mosquito forceps curved, my stitch Spencer scissors, and of course my Addison tweezers. Now you saw me right there. I went ahead and picked my spot. As you could see, the spot that I chose is actually a little bit deeper and a little bit longer, and the reason for that is because I wanted to show you guys the vertical mattress technique. So we've got horizontal mattress and vertical mattress. For me, the vertical one seemed a little bit easier to do. So with this one, our Addison tweezers are going to come in handy, very much so, because what you're going to see me do is I'm going to take those tweezers and I'm going to pinch a good chunk of skin. Okay, and I want to make sure that I'm a little bit farther out than I would normally do, like the single interrupted stitches, because this technique requires a lot of space. And as you can see right there, I've got my two big ones, so I've gone through the skin. Now here's the hard part. So you'll see me kind of messing around and showing you. So when we normally suture, you'll see will be one way. Here we're actually doing a backwards technique almost to come back through. It's really important that when we're doing these, we also want to make sure that we are careful in our placement. As you can see, I am having to really work with this to get the exact angle that I want. Not only the angle, but making sure that my hands, my wrists are comfortable in holding the needle and making sure that I place it in the proper way. So it does, again, it takes some time. I actually found a couple ways to do this. One of the ways you can see me is actually attempting to switch my tools. I am normally a right-handed person, but sometimes switching it my left seemed to help a lot better. Now, similarly to the single interrupted sutures we did, it's the same looping technique and pulling through with that tail. So again, our tail is really important. We want to make sure that we've got some good leeway with that. As you can see, that first one is done. Now this one was a little bit loose, but it is going to happen because of the depth of the wound over here. So we are going to go in with more and it'll work itself out. As you can see, I'm doing that second one, making sure I've got plenty of room because I am going to have to go back through there. So I've got that good chunk of skin. I am switching my needle around, making sure that my placement is good. And sorry, I got interrupted during my video, but it's all good. Anyways, I'll be threading the needle back through. As you can see, that first one went really easy. This second one, it took me a second. It can be very hard to get through it. And we want to make sure that we're still getting a decent chunk of skin. If you need to set your needles down to work on your placement of the needle and making sure that it's good, we wouldn't want to do it on the patient. We would have a tray and a surgical drape over doing this. For the sake of this one, this is a demo, so I do not have it draped fully like I would a normal patient, but you wouldn't see me putting it on said patient. You would also see me wearing gloves because we want to make sure that we are closing our lacerations in a way that can mitigate any type of infection or bringing in things that just kind of live on our hands that we don't want in our patient. We don't want our patient to have to deal with and risks of infection and whatnot. So as you can see, I've done two right there. I still felt like the wound needed a little bit more to be fully closed for the sake of this video and for the sake of we want our patient to make sure that they do have their wound closed properly. If a wound is not closed properly, the healing process can be delayed and we don't want to, or it can stay open and we don't want to risk infection for our patient again. So as you can see, I went through and here we go. I'm very much fighting this needle because this needle and I were not friends, but it's okay. Like I said with the last technique, they do take time. This is something you would have to work on. Working with materials that are not your hands can be very hard on the body. It is something that you do have to train yourself to do. So again, don't get discouraged. Just kind of work through it. It'll take time, but I promise when they start looking really well over time, you won't even remember how you started. So again, the single interrupted sutures were kind of like our beginner level. It helped us to learn these more advanced techniques because the tying is the same. Threading through the needle is more often the same. Obviously, threading back the needle is the new part for the mattress sutures, but we're doing pretty good. Not too bad. We're getting it done. Now, yep, you're going to see me kind of go back and forth again. We want to make sure our placement is right, and sometimes switching hands or giving your hand a quick little break, especially if you're new to this like we are. We're not used to holding these instruments in our hands, and it can be really discouraging to attempt to do something that you've never done before. Try switching your hands, try switching your angle of your wrists, your forearms, anything you can to ensure that everything is as it should. And just take your time with it. It's going to take time. It'll get easier. You can see me struggling to thread through that last one. Sometimes threading through can be hard, even with the tweezers. When the wound is first open, it's not as hard to do, but when the wound has already been closed up in multiple areas, it's starting to get a lot tighter. So getting those tweezers in there is really hard, and we're really now working without the space that we would have had on the other ones. So it can be very difficult towards the end, but just take your time. It will get there. And then once there we go, pulled it through. And we're going to go ahead and tie those off with that tail just like you've done on the last couple. Those 2 loops, pull through. 2 loops, pull through. 2 loops, and pull through. And that would be our vertical mattress sutures.